Good afternoon. My name is Catherine Chong. Welcome to another week of our Facebook live tutorial and also our YouTube weekly tutorial show. Thank you so much for tuning in today. It's my absolute favorite time of the week where I get to hang out with you one-on-one. Now, for those of you who just joined our channel, my name is Catherine Chong and I am the fertility dietitian based in Brisbane, Australia, where I currently consult to two medical practice in Brisbane and also run my own virtual consultation practice, seeing clients from all around the country. Now, my job is to help women who are trying to conceive and to help them to optimize their diets so they can improve their diets and to prepare their body to give the best chance to optimize the chances of conceiving. Now, if you are someone who are currently trying to conceive, or if you have been trying to have a baby for a while and pursuing IVF, I'm here to help you, to give you the actionable action step to help you to gain total clarity and also to share with you the simple actionable tips that you can take to help you to move through any roadblock that you have in order to help you to achieve that ultimate dream of having a healthy baby. Now, today we are going to look at whether or not you should start to take inositol supplements, especially if you have polycystic ovarian syndromes and currently trying to get pregnant. So we're going to dive into a little bit more specific in terms of the evidence behind the inositol supplement. But first, I want to share with you a client journey, which is, her name is Alicia. Of course, it's not the real name, but Alicia is actually one of my private coaching clients. Now, she was first diagnosed with polycystic ovarian syndrome, in another name, PCOS, at the age of 22. Now, if you haven't heard about PCOS, so PCOS is a condition called polycystic ovarian syndrome. It is the most common hormonal disorder in women's of reproductive age. So what it means is the time from when you first have your period to when they stop at menopause. Now, the truth is there's currently no cure to treat PCOS or PCOS, and it doesn't just go away on its own. The current treatment plans or management plans together with the doctors are very much focused on the diet and lifestyle changes to help to manage common symptoms such as irregular period, excess facial and body hair, the scalp hair loss, acne, weight gain, and also difficulty in getting pregnant, right? So when I first met Alicia told me that she could recall that she suffered from irregular and painful period when she was young, and she basically got her periods once every 5 to 6 months, and she was put on an oral contraceptive pill to manage some of the symptoms, but she basically stopped a few years ago because she now married and she's trying to get pregnant. However, despite not, using any protective, measure during sex and stop the pill, pregnancy hadn't happened after years of trying, and that's when Alicia went to see a specialist and to see, what is the best next options for her to have a baby, possibly looking at ovulation induction. So basically, what I have been working with Alicia for about 3 months now, is to help her to understand what actually is PCOS and to treat some of the underlying root cause of the PCOS, such as managing her weight, manage the insulin resistance, which can be a common cause of women with PCOS not getting the regular periods and also stopping the ovulation. So basically work around to restore her periods with low carbs and low GI eating plans. The good news is to date, Alicia actually has already lost more than 5 kilos and certainly has restored her periods in the last 2 months, so which is great. Now, however, she do have a question for me, is that does she needs to take inositol, right? As you know, if you just Google it right now, you will see that there's a lot of health claims with this magical inositol supplement products across Amazon, across Google, surround that, the claims saying that it may help to promote ovulations, improve ovary functions. So is there any evidence to support inositol? That's what we are going to dive into in today's episode. Now, first, we got to understand what is inositol, right? So inositol is a chemical compound, which also known as the sugar alcohol. What is interesting is inositol basically has 9 different forms. You probably will be most likely heard about these 2 forms called myo-inositol and also dichiro-inositol. Now, they both play an important biological role in mediating the different actions of our insulin hormone. Now, if you remember about what I teach you about insulin hormones, it plays a key role in terms of balancing women's hormones, women's reproductive health and weight management. So it's really a key role as in to manage the insulin hormones, right? So inositol also acts as an antioxidant to help to reduce your body oxidative stress. Now, talking about, where can you get inositol naturally? It's commonly found in fruits, nuts, and beans. And it does produce by the body naturally as well. And you can also take an inositol from supplement, either from powder forms, usually ranging between about 2 grams up to about 4 grams per day. It is also common that this day I do see some specialists starting to recommend inositol as well for women, especially trying to conceive and with PCOS condition. Now, what I want you to know, right? What is really the current evidence? Is there any current evidence to support the claims? As you know, in terms of science, is not always black and white. So today I'm going to break things down so you can decide the best, whether you need to take inositol, or if you do, what you need to know. All right. So the current research suggests that inositol supplements possibly may improve insulin sensitivity, especially if you do suffer from insulin resistance. It may help with menstrual regularity and also ovulation among women, specifically with PCOS. However, the safety of inositol hasn't been adequately studied. Now, this is the really important point here. For example, some evidence suggests that the highest dose of dichiro-inositol may lead to greater numbers of immature egg cells and worsen the egg quality. So you do need to be very vigilant when it comes to taking supplements. So instead of just, by reading some of the health claims across, say, Amazon or Google, you do need to, again, do your own, research, or the best to always consult your fertility dietitians and also your medical practitioner team to check whether or not you do need to take them and what is the ideal dose and whether it suits you. Now, the other important things to remember as well. Remember, I talked about there are 2 different types of inositol supplement. So one is called myo-inositol and the other one is dichiro-inositol. They actually share the same absorption mechanism. So there are actually some evidence that did show that if you do take both of them together, it does compete the absorption And their clinical evidence has demonstrated that we also possibly need to look at the different ratio. So far the best known ratio between the myo and dichiro supplements is 40:1 ratio, which quite commonly you might see some of the products do claim to have this ratio. The dosage they recommend it's approximately about 2 grams twice a day, and to take it before meals on an empty stomach. So that is, current research do suggest that by taking this ratio, it may help to restore ovulation in PCOS women. And bear in mind that, again, like what they say, there are research to supporting this. However, it's not a huge database yet at this stage. All right. Now, what about if you're looking at whether or not taking inositol supplement can actually improve pregnancy outcome or IVF outcome? So interestingly enough, there is actually a concurrent systematic review published in 2018, which is looking at the highest strength of evidence. So the authors basically analyzed 13 trials involving more than 1,000 women with PCOS, where they assess the impact of inositol before IVF, and also compared to a standard treatment without taking the inositol. So based on the available evidence, the authors concluded that they aren't able to see or to conclude if there's any high level of evidence to support the inositol supplement. It's just simply because the evidence is not strong enough to support in order to see an improvement in the live birth rate or clinical pregnancy. And at the moment, there's also no pool of evidence to suggest the use of inositol in women who are undergoing ovulation induction. So that is something that you want to bear in mind as well. So the bottom line, I guess, that what you need to know is inositol may help to improve insulin function, help you to regulate your blood sugar level, and hence better in terms of weight management. It might also promote ovulations in women with PCOS. There is also preliminary research, so a very new study found that a combination of inositol, folic acid, and N-acetylcysteine, another type of supplement, may improve ovarian functions in PCOS. Again, it's very early stage of the clinical trial, so I'll be more excited to see what's come up in the next coming months and years. All right, so now, what about some side effects? So, do you need to aware what is the side effects and the dosage? So basically, when we look at the safety data, so inositol supplement seems to be pretty well tolerated for most of the people. However, some mild effects have been reported with doses as high as more than 12 grams per day. And this includes feeling nausea, gassy, difficulty in sleeping, headache, dizziness, or tiredness. Now, generally, based on, again, the available safety data, up to about 4 grams of inositol daily, it's considered safe among the pregnant women without any adverse effects, but certainly more research needed in this group of population for sure. All right, we certainly have covered quite a lot today. So here are the 5 action steps I want you to take away from today's session. So number 1, if you have been taking an inositol supplement, or if you're thinking to start inositol supplement, make sure you check the types of inositol, the active ingredient that's at the back of the bottle. You want to see whether it is say inositol, or is it dichiro, or is it both, right? And secondly, you want to make sure that you check the dosage as well. Like I mentioned before, depending on the type of the inositol supplement. For what we know so far, a higher dose of D-chiro supplement seems to impact egg quality. And inositol supplement seems to be safe at a dose up to about 4,000. Again, I would strongly recommend to consult fertility dietitians if you are unsure. Now, you always also don't forget, you always also have the options of optimizing inositol from the natural source, such as making sure that you do regularly consume, in fact, daily consumptions of your fruits, nuts, and beans, and also whole grains. That's tip number 3 for you, to help you to make sure that naturally you are gaining sufficient inositol from the natural food source. And number 4, like I mentioned before, is to see a fertility dietitian to help you to assess your current fertility needs, your medical history, your blood tests, right? To help you to review the other supplements that you have or any medication that you have before advising what is the best type of supplement for you. And lastly, I just want to remind you that PCOS is a lifestyle intervention, right? So there's no magical pill that could help you to treat the condition. So while we're talking about inositol supplements, maybe an option for you to consider, but I do want you to again refocus on your eating patterns, your lifestyle, and try to treat the underlying root cause of the PCOS. That's the best natural way that can help you to maximize your chances of conceiving and getting pregnant. Now, if you enjoyed this episode, don't forget to press the subscribe button and share this video now with your friends and family. Now, you can also watch my other video, which I shared a few months ago, the 3 simple steps to get you started with a PCOS diet. I will attach the link down today's video, and also download your free fertility meal plan that can help you to get started with a 5 days full meal plans, a recipe to help you to get started with a healthy eating plan if you're trying to conceive. Alright then, thank you so much everyone for tuning in today's tutorial. I will see you next week, next time, at the same place, and bye for now everyone. Have a great week.